Good afternoon, Dr. Berger.
Good afternoon, Irina.
Would you be kind enough to introduce the practice and tell me a little bit about GLP-1s being taken in the short term?
Absolutely. So I'm Dr. William Berger, owner and founder of Northeast Medical Practice. We are a concierge-style internal medicine, weight management, and aesthetics clinic located in Great Neck, New York on Long Island. And behind the camera is the administrative director of Northeast Medical Practice. Her name is Irina Berger. So there is this myth and a common question that we are asked by our patients about short-term use of weight loss medications in general. People want to know, how long do I need to take it? When can I go off it, etc. So let me give you a little bit of background here. So obesity is considered a chronic disease. It has been for over 10 years. And what that means is that we have to treat it long term. It's similar to hypertension, high blood pressure. So for example, if I get somebody's blood pressure under control with a medicine, once we get to a normal blood pressure, we don't say, yay, let's stop the medication, because most likely their pressure will go up again, right? Maybe if they had a lot of lifestyle changes to make, maybe they can go back off it. I have been able to do that sometimes when people improve their lifestyle. However, majority of patients, when they're started on a blood pressure medicine, are on it lifelong because it's a chronic problem, especially if they have just a genetic predisposition to high blood pressure. They'll just need medicine. And obesity is the same thing, and I'll give you a little bit more detail about it. So when we use a medication and get somebody's weight down, medicine plus lifestyle, always lifestyle improvement and healthy lifestyle. If we were to stop the medicine at that point, studies have shown that most patients will gain weight. The SURMOUNT trial, for example, with Zepbound showed this. When patients, after 1 year, half the patients continued their medicine and the other half got placebo. The placebo group mostly gained weight. So we have to be very careful. If I was to just stop somebody's medication and they started to gain, if I let that go too far, it gets harder to get the weight down the second time, because every time you go through a yo-yo cycle, medicine or no medicine, your resting metabolic rate never comes back to where it was. So each cycle you go through, it gets harder and harder to lose weight. So what I often do is I will taper the medicine down and watch the patient's weight and muscle mass very closely with the body composition analysis that we do. And if we find that weight gain is starting to happen as we get to a low dose, or maybe even try stopping and see what happens, I'll either restart the medicine or increase the dose. But for most patients, what I find after a year or so of treatment usually is that we figure out what the maintenance dose is, which is usually a lower dose of the medication. For example, with Zepbound, there are 5 dosing levels from 2.5 to 15 milligrams. Maybe we would settle on 5 milligrams as a maintenance dose, for example. Different for everybody. But that's usually how we need to approach it. So I always start the conversation about managing a patient's weight as this is a long-term proposition, not only with lifestyle change, but if we use medication, you may need to be on it long-term. We might be able to decrease the dose, find a maintenance dosing level, but you should be prepared for the long-term, and that you'll most likely need some medicine in a small dose going forward. So as always, everything that we share here is for educational purposes only. No doctor-patient relationship has been formed, and if you have questions, concerns about your health, please don't hesitate to reach out to your healthcare professionals. If you'd like to reach us, the number in the office, 516-604-3418, or online at northeastmedicalpractice.com. You can visit our YouTube channel and also our new podcast on Spotify, which is called Longevity MD, where I have a new episode on screening for prostate cancer with the PSA. So until next time, be in good health.
Thank you, Dr. Berger.
My pleasure.